All right, let's crack the code on what is, for so many people, one of the trickiest topics in nursing: acid-base balance. But here's the thing, we're going to forget all that stressful memorization. We're going to use a powerful method that uses just a handful of simple principles to solve pretty much any problem you're ever going to face.
And this quote from Mark Klimek really just hits the nail on the head. See, the goal isn't to cram your brain with endless list of signs and symptoms that you're just going to forget under pressure anyway. It's to understand the principles, the rules that actually create those symptoms in the first place. Once you know the rules, you can build the list yourself, on the spot, every single time. So where do we start? Well, tool number one is a super simple trick for looking at a complex lab report and knowing what's going on instantly. You can forget all those different values on an ABG report for now. You really only need to focus on two. And here it is, the rule of the Bs. Honestly, it's all right there in the name. If the pH and the B carb are both heading in the same direction, so both up or both down, then the problem is metabolic. That's it. It's a quick, simple check that just plain works. And believe it or not, these are the only two numbers you need to get started. You probably already have the normal pH range, 7.35 to 7.45, burned into your brain. Just add the normal bicarb range, which is 22 to 26, to your toolkit, and you're all set. Okay, let's see it in action. Say the pH is 7.30. Well, that's low, so let's draw a little down arrow. The bicarb is 20, which is also low, so that gets another down arrow. So, are they both in the same direction? Yep, which means it's metabolic. And since the pH always tells you the main problem, a low pH means acidosis. Boom! Final answer, metabolic acidosis. Simple as that. Okay, so that brings us to tool number two. We can identify the imbalance now, but what about predicting the signs and symptoms? What's the patient actually going to look like? And again, the whole goal here is to do it without memorizing a single thing. This next principle, this is the master key. It unlocks everything. It's this. As the pH goes, so goes my patient. It's that direct. When the pH goes up, body systems get fast, irritable, hyper. When the pH goes down, they slow down, they shut down. Now there's only one exception, and that's potassium. Potassium always does the opposite. So you can really think of it as a night and day difference. Alkalosis, with that high pH, makes the patient go up. You're thinking irritability, hyperreflexia, tachycardia, seizures. Everything is just firing on all cylinders. Acidosis, with its low pH, makes the patient go down. Think lethargy, hyporeflexia, bradycardia, all the way to coma or even respiratory arrest. All right, time to put this powerful principle to the test with a classic select all that apply question. You know these questions. They can be so intimidating, but watch how our rule turns this from a guessing game into a simple logic puzzle. So instead of panicking and trying to remember a list, we just apply the rule. First things first, the question says acidosis. What does that mean? It means the pH is down. Okay, so if the pH is down, then our patient is going down. Now all we have to do is scan the options and pick everything that represents a body system slowing down or shutting down. And just look at the power of that principle. +1 reflexes? Yeah, that's down. A dynamic ileus, that's when the bowel just stops moving, that's definitely down. Urinary retention? Down. A second-degree heart block? Oh yeah, that's for sure down. And just like that, we answered a really complex question with one simple rule. No memorization required. And here's a little bonus tip for a very specific symptom you might see. Small respirations. That deep, labored, almost frantic breathing pattern. If you ever see that on a test, just think of the name Small. It's kind of goofy, but it works. The name itself reminds you that you only see this with metabolic acidosis. Okay, so we can identify the imbalance and we can predict the symptoms. Let's move on to the final piece of the puzzle, figuring out the root cause. What's actually causing this problem in the first place? So when a question asks what's causing the imbalance, it can feel overwhelming, right? The list of possible diseases and scenarios just seems endless. But there is a much, much simpler way to cut through all that noise. And this is it. This is the critical first step. Before you get lost in the weeds of the clinical scenario, just ask yourself one simple thing. Is it lung? Is this a problem with the lungs? That one question immediately cuts all your possible answers in half. This simple decision tree takes care of everything else. So you ask, is it lung? If the answer is yes, then you know it's respiratory. From there, you just have to figure out if the patient is breathing too fast, that's overventilating, which causes alkalosis, or breathing too slow, underventilating, which causes acidosis. Now, if it's not a lung issue, you know it's metabolic. And for metabolic, it gets even easier. Just ask, is there prolonged vomiting or suctioning? If yes, that's your answer, metabolic alkalosis. And for literally almost everything else you can possibly think of, just pick metabolic acidosis. It's the default answer. And there you have it. In just a few minutes, we've built a complete toolkit, a set of simple, powerful rules that lets you confidently deconstruct any acid-base problem that comes your way. And this is your ultimate safety net. It's your ace in the hole. If you are ever faced with a scenario or a disease you have never heard of, and you have to guess the resulting imbalance, what's the safest bet? Metabolic acidosis. It is, by a huge margin, the most common answer for anything that isn't a lung problem or prolonged vomiting.
So these 5 rules, this is your entire toolkit. From figuring out the imbalance with the rule of B's, to predicting what the patient will look like with the pH rule, all the way to finding the cause with our decision tree, you now have a principle for every single step of the process.
So let's end with this thought. Now that you're armed with these principles, a difficult question like select all that apply isn't a threat anymore, is it? It's actually an opportunity. It's an opportunity to prove that you understand the core physiology behind what's happening. It's not about what you've memorized. It's about what you can figure out. And that right there is a much more powerful way to learn.